I think nurses and nursing organization always impact public health. We are the largest group of healthcare professionals globally and in just about any country. So it's really hard to imagine any policy existing without a nurse being involved at a minimum in implementing it. And our point is that if you are at the tail end of implementing these policies that impact your patients or impact your communities, you should be upstream in the development of these policies and really reflecting the experience both of the nursing practice, but also of the patients and the communities you're serving. So I think nurses, need to, and in general, you will be surprised by how often nurses and nursing organizations are involved in public health policy, but they don't always get the acknowledgement or recognition. So sometimes it's a little indirect. Sometimes it's not known that somebody's a nurse. So I think that creating that identity is very important. But I can't imagine any public health policy that could not be positively impacted by including nurses. And so, take your pick, all of them, really. And I think that's nurses need to be at all levels, perhaps better socialized to really feel comfortable in that role, to feel like they not only that they have a seat at the table, but they have a voice and they have something to say. So it's not enough to be in the room, but you have to be in the room with a message. And that message usually is about, again, improving patient and community care at some point. So that I know is very generic, but I just, really think that some of the ways in which nurses are engaged, which is sort of your next question, is, they can do press releases, they can do position statements, they can do letters to the editors, they can come and speak in public hearings. So there are all kinds of different ways in which nurses can participate in the policy process. They don't have to be policymakers. Any nurse can participate in the policy process at a minimum, like by having an opinion about a certain policy and whether or not they think that would be favored to their patients and communities. But when we talk about developing our health policy statements, we look at things that are, one, relevant, of importance. We look at things of our significance. So they're relevant, they are significant, they make an impact. They are directly related to nursing, either research, education, practice, of all of the above. And but most of the challenges, I think, when it comes to dissemination and implementation is, as a global group, ISNCC developed this, principles and aspirations and ideas and things that we think should happen. But that has to trickle down to the country and sometimes even to the institutional level to actually be implemented. And so implementation really happens at the local level, national, or like I said, sometimes even just institutional level. And I think dissemination, we need to be careful that we don't confuse distribution with dissemination. Just putting on a website and saying it's there, that's distribution. Dissemination is really helping people understand how these position statements are tools to advance a policy agenda. They are to be used. They are to be, they only exist if somebody uses them. Otherwise, they are a link on a website. And I think some of the challenges are overcoming perhaps some of nurses' hesitancy to involve themselves in policy and providing enough, mentorship and support for nurses to feel confident in using those tools, which many, many are. Yeah.